Welcome back to Healthcare in the Public Sector, sponsored by Verizon Enterprise Solutions on federalnewsradio.com and 1500 AM. I'm your host, Jason Fornicola, and I'm joined by Nancy Green, Verizon's Global Healthcare Practice Lead, and Peter Pinn, Verizon's Regional Vice President of Civilian and Public Sector Markets. Nancy, we see healthcare moving away from traditional models of location-based and appointment-driven care. Can you speak to those drivers and what a Care Anywhere system looks like?
Yeah, so I think the first and foremost, if we level set that it's not just the patients wanting that and needing to be able to have care anywhere, it also has to be able to be done from a clinician's point of view. With the shortage of clinicians and the increase of patients coming in, we really have to find very secure solutions to be able to deliver care anywhere. And that could be your home, could be a hotel, could be in a retail clinic, it could be anywhere. The days of putting a brick and mortar site somewhere are really being challenged in the healthcare system because of this movement towards technology.
Can you talk about some examples where this is in play? And this could be in a neighboring town, if you're on vacation across the country, or on vacation across the world, where you might want to be in touch with your doctor or your nurse and get some information or talk about a situation, or even if maybe you've had an accident or something like that and you just need that personal touch point with your doctor.
Yeah, so there's a lot of rules and regulations around where a physician can practice medicine, and it has a lot to do with where the patient is, not where they are. But there's a lot of movement towards, and a perfect example has a little bit to do around the retail kiosk type of solutions where you have the ability to go into a kiosk type of environment and be able to see a doctor virtually. Have all of the stethoscopes and all the different pieces. You can even have blood drawn in some of these smaller retail kiosk clinics to be able to then have care given to you at the time that you need it, whether that's just a flu shot or whether it's full care. When you look at going into, let's say I'm at a hotel and I'm sick and I want to go back into my physician's office, if they have the opportunity or have set up virtual video or virtual visits type of system, I then have the ability to do that. They know who I am. They can prescribe electronically, so I can go to my local retail pharmacy and get the prescription that they applied to me. So there's lots of different ways to do that. You can even apply it into the chronic care area where I'm remotely monitoring a patient in their home.
You mentioned some of the limitations. Can you just give us a sense for maybe what they are or what you can do and what you can't do?
A lot of those are state driven. So it has to do with certain states that allow some virtual care and others that don't. And they're all over the map, so it depends on which state that you're in. The federal government does it a very specific way as well. The VA does it a very specific way in their system. So you just have to know the rules and regulations. The technology's there, though, so the technology's not the issue. And I'm seeing some very exciting movement and pilots around virtual care or anywhere.
Peter, from your sense, what does Care Anywhere look like in the federal sector?
So mobility is absolutely changing the way healthcare access is taking place today. So when a patient, regardless of demographics, has access to a smart device and a network, his whole world opens up. For example, access to transportation services, social support, healthcare services, all with a device and access to a network become a reality. A lot's changing in that piece, but also in terms of how, the agencies are delivering this. So I'll give you an example of what's maybe an analogy that might help. So back in the day when we were buying cars at dealerships, most of the information was held by the dealership, with the cost, the price, the features. When the internet came about, that power of knowledge shifted to that consumer, that user. And so what happened is that conversation changed and interaction with the person on the other side of the table changed. Well, that's what's happening in healthcare. So the patient now is empowered with a lot more knowledge to be able to bring to the table questions that have more relevance to his healthcare, to his medication, to his treatment, to any number of different things. And when you put that with mobility, you've now expanded this power in a much different way. So agencies absolutely have to change the organizational processes to support this kind of movement.
I think I would just add it's the care team, so that can be the family members as well. So it's
absolutely
the informational sources that you have access to, and I would call that transparency, and it's getting pushed by a lot of legislation that you absolutely have to be transparent if you are an organization about the costs the rate of infections, all these different things that consumers can now look at, and the care teams can, and that care transition between all of those is a key component to this.
Mobility, increased technology, leading to a more engaged, more educated patient, right? How has that impacted the relationship between the physician and the patient?
If you ask the physician, actually, I laugh because some physicians love it and some don't. And I think that's generational. Has a lot to do with they're just as agile on technology as their patients might be. And some of the older generation is not, and really relies on the things that they trust. Part of the whole healthcare system is trusted information, and trusted information is not something traditionally that a patient tells a physician, right? Because that sometimes is not the truth.
Generally, you go to the physician, they are the ones with the answers versus going to the physician now and perhaps self-diagnosing or something like that.
Exactly.
Right?
Lots of information that you can go think and pull reams and reams of data to say, hey, I think I have this, or this is all the information, or this is the data from my Fitbit, this is the data from all these different devices, and here you go.
Right.
And without a picture in time of the whole story, the physician has a hard time with contextual data.
So then how is Verizon innovating around this Care Anywhere approach, and what are some things that you all have to offer?
So we have an actual formal innovations program, but there's so many different exciting things that we've done that we've enabled organizations, large and small. So small organizations that have really unique medication adherence, where we've virtualized or mobilized and digitized a pill bottle that knows exactly when a pill was taken, can notify when they're not. All the way to connectivity between EMTs and an ED to be able to transport or not, which is saving so much money in the healthcare system for avoidable transports to the ED, mental health transmissions, things like that, and some of the other really interesting videos, right? So if I want to be able to do a video conversation with someone anywhere, being able to do that and look at data at the same time, those are things that we've transformed through some of our innovations programs and our partners.
And Peter, your thoughts?
So to add on to what Nancy said, so one of the things beyond products like that is we've really opened up our innovation centers to allow this thought leadership and these innovators to come in and really test out what they're doing. With the help of our labs and engineers, they actually can develop the prototypes and showcase them. Yeah. And so this has opened up a whole incredible world. And if you ever go to an innovation lab, you can see the present and the future in many different ways. And in healthcare, we have vignettes that do nothing but show what it could be like. And this has really spurred great ideas and thought.
Some of our largest clients come in and had no idea that we could do it this way, even looking at something from a different vertical perspective, saying, we can do that in healthcare and we can really make a difference doing that.
We're going to pause here for a short break. My guests today are Nancy Green, Verizon's Global Healthcare Practice Lead, and Peter Pinn, Verizon's Regional Vice President of Civilian and Public Sector Markets, on healthcare and the public sector, sponsored by Verizon Enterprise Solutions. I'm your host, Jason Fornicola, and you're listening to federalnewsradio.com and 1500 AM.